Erectile function is a key component of male health, yet it is often surrounded by myths, quick fix promises, and misinformation. As a medical professional with years of experience, Dr. Dahiana focuses on delivering science. In this series, we will explore how certain nutrients, particularly one key vitamin, play an essential role in improving erectile quality naturally and safely. This first part sets the foundation. Understanding how erections work, the critical role of circulation, and how specific deficiencies can impact sexual performance. How erections work. A medical overview. Erections are complex physiological events that involve the nervous, vascular, and endocrine systems. When a man is sexually stimulated, the following sequence of events takes place. Neural activation. Sensory or psychological stimulation triggers nerve signals from the brain and spinal cord. Vasodilation. These signals prompt the release of nitric oxide in the penile tissue, causing smooth muscles in the arteries to relax. Blood flow increase. Relaxed vessels allow more blood to flow into the corpora. Venous compression. Blood is trapped in the penis's veins are compressed, resulting in an erection. For this process to occur properly, optimal vascular health, nerve signaling, and hormonal balance are essential. Common causes of erectile difficulties. Before discussing solutions, it is crucial to understand the most frequent reasons men experience erectile challenges. These include poor blood circulation due to high blood pressure, atherosclerosis or diabetes, low testosterone levels, chronic stress and anxiety, smoking and alcohol use, obesity and lack of physical activity, nutritional deficiencies. Each of these factors can compromise the erectile process, especially circulation. That is where nutrition, and specifically certain vitamins, come into play. The link between vitamins and erectile function. Vitamins play critical roles in cardiovascular health, nerve transmission, hormone regulation, and energy metabolism, all essential for sexual performance. Among all the vitamins, one stands out for its direct impact on vascular function and nitric oxide production: vitamin D. Vitamin D is more than just a vitamin. It functions like a hormone in many systems of the body. Low levels of vitamin D have been repeatedly associated with erectile dysfunction in multiple clinical studies. What does vitamin D do? Regulates nitric oxide synthesis. Nitric oxide is vital for vasodilation, expansion of blood vessels. Vitamin D enhances the function of endothelial cells, which are responsible for producing nitric oxide, improves testosterone production. Several studies have suggested a correlation between higher vitamin D levels and increased testosterone, the primary male sex hormone that influences libido and erectile strength. Reduces inflammation. Chronic inflammation is a hidden cause of vascular damage. Vitamin D has anti-inflammatory properties that help maintain the integrity of the circulatory system, supports mood and mental health. Depression and anxiety are known contributors to erectile dysfunction. Vitamin D is linked to mood regulation through its influence on serotonin and other neurotransmitters. Scientific evidence linking vitamin D to erections. The European Urology Journal published findings that men with vitamin D deficiency had a significantly higher risk of erectile dysfunction. A study in the Journal of Sexual Medicine found that supplementation with vitamin D improved erectile performance in men with mild to moderate dysfunction. Another study from the University of Milan observed that men with normal vitamin D levels had healthier endothelial function, which directly supports the erection process. What happens when you're deficient? Men with low vitamin D levels may experience reduced blood flow to the penis, lower libido, due to hormonal imbalance, increased fatigue and depression, poor cardiovascular health, increasing the risk of chronic ED. Why so many men are deficient vitamin D? Deficiency is widespread globally due to limited sun exposure, excessive use of sunscreen, living in northern latitudes, aging, poor dietary intake. This makes supplementation and lifestyle adjustments a logical and effective solution for many men seeking better erectile health. How to know if you're low in vitamin D? The best way is through a blood test, specifically the 25-hydroxyvitamin D test. Optimal levels are generally considered to be between 40 and 60 ng per milliliter. Many men fall below this range without knowing it. Conclusion of Part 1. In this first part of our series, we explored the physiology of erections, the central role of blood flow, and how vitamin D deficiency can silently undermine performance. In the next section, we will explore how to safely raise vitamin D levels, the best supplement forms, timing, and how quickly results may appear when deficiency is corrected. Stay tuned for Part 2, How to Use Vitamin D Effectively to Improve Erection. In the first part of this series, we discussed the science behind the crucial role of circulation, and how vitamin D deficiency may contribute to erectile dysfunction. Now, we shift focus to practical application. How to increase and maintain optimal vitamin D levels, how soon results might appear, and what men should know about safe and effective supplementation. How vitamin D works in the body. Vitamin D is fat-soluble and acts more like a hormone than a typical vitamin. After it is absorbed through the skin or through diet or supplements, it undergoes conversion in the liver and kidneys to become active. This active form calcitriol regulates hundreds of genes involved in hormone production, inflammation control, immune balance, and vascular function. When used correctly, vitamin D can support increased nitric oxide production, healthier blood flow, enhanced testosterone levels, better mental health and energy, reduced inflammation in vascular tissues. What is the optimal dosage for men? There is no one-size-fits-all answer, but general guidelines supported by medical literature suggest maintenance dose for adults, 1,000 to 2,000 IU per day. Therapeutic dose for deficiency, 4,000 to 10,000 IU per day. Temporarily, depending on baseline levels. Important. Men with diagnosed vitamin D deficiency may require higher short-term doses, but only under physician supervision. Long-term high doses without monitoring can lead to toxicity. How to take vitamin D for best absorption. Take with fat-containing meals. Vitamin D is fats, meaning it requires dietary fat for proper absorption. Taking it with a meal containing healthy fats, such as eggs, nuts, avocado, or olive oil can enhanced effectiveness. Morning or midday is best. Some studies suggest that taking vitamin D earlier in the day may support better energy and hormonal rhythm. Taking it at night may disrupt sleep in some individuals. Consistency matters. Daily intake is more effective than occasional high doses. Sunlight versus supplements. Sunlight exposure. The skin synthesizes vitamin D when exposed to UVB rays. Here's what you need to know. Aim for 10 to 30 minutes of midday sun exposure several times a week. Fair-skinned individuals need less time. Darker skin may require more. Avoid overexposure and sunburn. Latitude, season, age, and skin tone all affect synthesis. Limitation: in many regions and during certain seasons, sunlight is insufficient to maintain optimal levels. Dietary sources of vitamin D. While not as potent as sun or supplements, some foods can support healthy levels. Fatty fish, cod liver oil, egg yolks, fortified dairy products and cereals, mushrooms. However, food alone is rarely enough to correct a deficiency. Supplements, forms, and quality. When choosing a supplement, vitamin D3 is preferred over D2, as it is better absorbed and more effective in raising blood levels. Look for products that are third-party tested for purity and potency. Liquid or soft forms tend to absorb better than tablets. How long before results appear? Many men ask how quickly vitamin D supplementation will lead to noticeable improvements in erectile function. The answer depends on several factors. Severity of deficiency: the lower your starting level, the more dramatic your improvement may be once corrected. Consistency of use: daily use is key to building and maintaining blood levels. Other lifestyle factors: improvements are faster when combined with healthy habits, exercise, weight loss, better sleep, reduced alcohol, and smoking. Typical timeline: 2 to 4 weeks. Improved mood and energy: 4 to 8 weeks. Enhanced circulation, possible early improvements in erectile firmness, 8 to 12 weeks. Significant improvement in erectile quality for many men with prior deficiency. Realistic expectations: vitamin D is not a magic pill, but for men who are deficient, correcting it can lead to substantial improvements in sexual performance and overall vitality. It is one part of a broader strategy that should also include cardiovascular health, hormone balance, stress management. Physical activity combining all of these elements yields the best long-term results. Can you take too much? While rare, vitamin D toxicity can occur, particularly with excessive supplementation over long periods. Symptoms may include nausea, vomiting, weakness, and fatigue, kidney problems, high blood calcium, which can be dangerous to avoid this. Do not exceed 4,000 IU daily without medical advice. Periodically test your 25-hydroxyvitamin D level if supplementing long-term. Combine with magnesium and vitamin K2, which support safe calcium metabolism. Myth busting. Vitamin D does not work instantly despite misleading headlines. Vitamin D does not make the penis hard in seconds. The truth is more nuanced and rooted in biology. Vitamin D improves underlying systems, blood flow, nitric oxide levels, hormonal support that support erectile capacity over time. It should be viewed as a foundational tool, not a quick fix. By resetting these systems, vitamin D helps restore normal erectile responses, but results require consistency and patience. Conclusion of Part 2. Vitamin D, when used correctly, is a powerful ally in improving male sexual function, especially in men with underlying deficiencies. It supports the vascular, hormonal, and mental health components needed for strong, sustainable erection. But like any effective health intervention, it must be taken with care, knowledge, and medical guidance. In Part 3, we will explore what other vitamins, minerals, and natural strategies can complement vitamin D to maximize sexual health and performance. As we've seen in Parts 1 and 2, vitamin D plays a significant role in supporting erectile function, especially in men with deficiency. However, achieving and maintaining strong, reliable erections involves more than just one vitamin. This final part of this series explores complementary nutrients, lifestyle practices, and evidence-based strategies that can enhance male sexual health holistically. 1. Key vitamins and minerals that complement vitamin D. Magnesium. Magnesium is crucial for testosterone production, cardiovascular health, and muscle relaxation, including the smooth muscle and blood vessels that controls blood flow to the penis. Supports vitamin D activation, reduces inflammation, promotes better sleep and stress management. Sources: pumpkin seeds, almonds, spinach, dark chocolate. Magnesium glycinate B. Zinc. Zinc is essential for male hormone balance and sperm quality, directly supports testosterone synthesis. Deficiency linked to low libido and erectile dysfunction, also supports immune health. Sources: oysters, beef, pumpkin seeds, cashews. Zinc. Picolinate C. Vitamin K2, often taken with vitamin D3. K2 ensures that calcium is directed into the bones rather than accumulating in blood vessels, which could harm circulation. Prevents arterial calcification, enhances the safety and efficacy of high-dose vitamin D sources. Natto egg yolks, hard cheeses. K2, MK7D, B vitamins. These vitamins are involved in nerve health and blood vessel function. Lower homocysteine levels support energy metabolism and mood. Sources: leafy greens, eggs, legumes, beef liver. Whole grains 2, herbal and natural compounds backed by research. L-citrulline and these amino acids are precursors to nitric oxide, a key molecule involved in the erection process. Promote vasodilation and improve blood flow. May improve erection hardness and duration. L-arginine dosage: 1,500 to 3,000 milligrams of L-citrulline daily. B. Panox ginseng. Known as the herbal Viagra, ginseng has been studied for its effects on sexual performance, enhances libido and stamina, may improve erectile strength and satisfaction, also supports immune function and stress resistance. Note: quality and dose matter. Standard extract of 200 to 400 milligrams daily may be effective. C. Maca is known for increasing libido and energy levels. Does not affect testosterone directly, but enhances sexual desire. Also supports mood and fertility. 3. Lifestyle changes that support erectile health. A physical activity, exercise improves blood flow, reduces stress, and supports healthy hormone levels. Resistance training boosts testosterone. Cardio enhances vascular function. Aim for at least 150 minutes of moderate activity per week. Weight management. Excess body fat, particularly around the abdomen, is associated with lower testosterone and higher risk of ED. Fat tissue converts testosterone into estrogen. Losing weight can naturally improve hormonal balance. C. Sleep quality. Testosterone production peaks during sleep, especially REM stages. Aim for 7 to 9 hours per night. Poor sleep increases cortisol, which suppresses sexual function. D. Stress reduction. Chronic stress elevates cortisol and reduces libido. Meditation, deep breathing, therapy, and regular physical activity can help. Psychological factors are a major contributor to it, especially in younger men. Limiting alcohol and quitting smoking. Both substances impair blood flow and reduce sexual sensitivity over time. Alcohol can suppress testosterone and nervous system responsiveness. Smoking damages blood vessels, directly affecting erection quality. For monitoring hormones and lab work, if erectile issues persist despite lifestyle and nutritional improvements, consider checking testosterone, estradiol, vitamin D, zinc and magnesium levels, blood sugar and lipid profile, thyroid function. Working with a healthcare provider to interpret and act on these results can lead to a more targeted approach. 5. What to expect from a holistic plan by combining optimal vitamin D levels. Key vitamins and minerals, targeted herbal supplements, lifestyle modifications. Most men can expect gradual, sustainable improvements in morning erections, erection firmness and duration, libido and sexual confidence, energy, mood, and overall vitality. It is important to stay consistent and understand that true sexual wellness is a reflection of whole body health. 6. When to seek medical help. If erectile dysfunction continues despite nutritional and lifestyle changes, it may be a sign of vascular disease, diabetes or insulin resistance, low testosterone or other hormonal imbalances. Psychological factors, medication side effects. Always consult a medical professional for personalized guidance. There is no shame in seeking help. Sexual health is part of overall well. Conclusion of Part 3. The full picture of male intimacy health. Improving erectile function isn't about chasing shortcuts or quick fix pills. It's about nourishing the body, correcting deficiencies, supporting hormone health, and making consistent, smart lifestyle choices. Vitamin D is a foundational piece, but combining it with other supportive nutrients, herbs, and habits can elevate your sexual performance and overall health in powerful ways. Dr. Dahiana encourages you to view intimacy not as a separate issue, but as part of your entire health story, one that you can strengthen through knowledge, action, and commitment.